Hello everyone and welcome to Eat Well with Azar. Almost everyone has suffered or at least has complained about headache and migraine at some point in their lives. Headache may be the result of bad eyesight, a head injury, hunger, dehydration, absence of caffeine or nicotine, lack of rest, or even poor diet and nutrition. Symptoms can range from mild to moderate, from severe to migraine. Headache caused by poor nutrition can be prevented by proper dietary changes. It feels good to be able to create a plan to take charge and gain back the control of your life. By recognizing what the triggers are, you will be able to avoid and manage the headache and migraine better. Dr. Gyzel Aval is my guest today to help us to learn how to recognize the triggers and manage and cope the migraine better. Dr. Gyzel is a highly respected board certified doctor of chiropractic. Her specialty is to reduce and control chronic pains such as headache, low back pain, and neck pain. Thank you for being with us, Dr. Gyzel, today.
Thank you for having me.
Would you please explain to us what migraine and headache is?
Sure, Azar. So most headaches originate in the upper neck that involve nerves, blood vessels, and the muscles that cover your head and neck, okay? So if there's a lack of proper function in the neck, it causes abnormal behavior, pain, and discomfort. The muscles or the blood vessels get swell up, it gets inflamed, it puts pressure on the muscles around the neck, it becomes tight, and then it puts pressure on the surrounding nerves, okay? And the nerves send a rush of pain messages to your brain along the path of the other nerve, and you end up with a headache. Migraines are more than just your typical headache. Most often a typical headache, a typical migraine, a person who is actually suffering from migraine, you have to go in the dark room, in the quiet room to kind of settle and let the pain ease. Migraines is also different from headaches because they occur in phases and they also come with other symptoms as well. So it is believed that vascular changes in the brain are responsible for the pain. Researchers have noted that certain people experience blood vessel contraction and dilation in the brain prior to having migraine. And these contraction and dilation in the brain can be influenced by neurological and hormonal factors. And experts are investigating these areas for more potential solution to migraine.
Okay, what are the types of headache and migraine? Is there any different types?
Yes, there is. So there is 4 types. You got the sinus headache, you got the cluster headache, you got the tension headache, and of course you got the migraine. So sinus headache, as you can see around here, it's basically when the sinus becomes inflamed and you feel it around your nose, around your eyes, around your forehead, so around this area basically. And it's often due to infection. And it can cause pain, and it can also cause fever if it's infection. And you will actually evaluate that by other symptoms as well. If it's not infection and you just feel like your sinuses, it just hurts around that area, most likely the nerves in the neck are blocked, and we just have to basically take that pressure off that nerve and let that flow properly in the nervous system, and also activate that nerve supply to the sinuses, okay? And then you got the cluster headaches. Cluster headaches often affect more men than women, and they occur in groups or cycles, and they appear suddenly, and they can be very severe. As you can see here, it can happen in one side, around the eye, behind the eye, and it's usually more common in men, and you can end up with runny nose, congestion around that area. And then you got the tension headaches, which is the most common type of the headache that almost every male and every female experience it. And that's the kind of pain you feel around your forehead, around your temples, around the back of the head, and around your neck. That's when you feel like a band kind of pushing against your head. That's tension headache. And then you got the migraine headaches, of course. A migraine can run in families and is diagnosed using a certain criteria. So you have to have at least 5 episodes of headaches that last between 4 to 72 hours, okay? And most of the time you feel certain kind of symptoms, and most likely you have it on one side of the face. It feels like a throbbing pain. It can be moderate to severe, and also it will stop you from certain activities. So you cannot do a certain activity. You must be sitting in this dark, quiet room and just settle to let the pain go away. And also you can have symptoms like nausea and vomiting, and also you can have sensitivity to light and sound. And so these migraines, they can come in 2 also types. You got the common migraine and you got the classic migraine. Classic migraine is when you actually feel it also comes with aura. And aura is basically visual distortion, speech difficulty, numbness, tingling in the hands, and usually 15 to 20% of people experience that. And aura is kind of like a warning sign for the people with migraine. It's kind of like telling them migraine is coming, so maybe they can take some kind of action before it gets more painful. So those are the types of headaches and migraine.
Yeah, I have seen people going to the dark room and sitting there for hours for their migraine to go away.
Exactly.
It's really hard.
It is.
Is there any gender or age group are more at risk?
Yes. So some factors make you more prone to having migraines, such as family history, age, gender, and hormonal changes. So almost up to 90% of people with migraines have a family history that have migraine attacks. And it can begin at any age, but most people experience their first migraine around their teenage years. So women are 3 times more to have migraines. However, headaches are more affected towards boys than girls during childhood. And then once they reach their puberty, that's when women actually get more headaches and migraines more than men. And if you're a woman who has migraines, you may feel your headaches begin just before or right after your menstrual cycle because of the whole hormonal changes happening.
Would you please explain to us what the triggers are?
Yes, so it could be emotional triggers, nutritional, and structural. Structural is the most common. Emotional and nutritional, it can be 10% of the headaches are caused by those. So 10% of headaches are caused by uncorrected vision problems, like maybe you need glasses, dental problems, maybe you need to go to a dentist, changes in the weather, changes in the air pressure, hormonal imbalances, depression, emotional stress, season allergy, food allergy, lack of sleep, even using a wrong pillow maybe that can cause headaches, environmental chemicals, liver problems, hypertension, some medication, and even certain foods that we eat, caffeine and dehydration. And then the other 90% of headaches aggravated or caused by cervical spine condition, such as pinched nerve, or more correctively we call it subluxation, which is misalignment in the spine. And that can cause from, old car accidents, sport injury, any kind of trauma, even birth trauma, loss of proper curvature in the spine, and obviously bad posture, which is very, very important. So any kind of physical stress that you have, any kind of work that you're doing on a daily basis, sitting behind the computer for 8 hours like this, or even texting, using your phone with head down, that all creates a lot of pressure around your head and neck. And so it's very important to create that proper curvature in the spine. So imagine my forearm being the neck and my hand being the skull, and your head weighs about 16 to 24 pounds depending on the person. So let's say I'm holding a 16-pound bowling ball in my hand. Do you think it's easier if I hold it this way or this way?
This way.
This way, right? How long do you think I can hold it like this?
Not too long.
Right? I'm going to put all that pressure in the neck area.
Right.
And that eventually causes pressure in the muscles. They become tight, they become inflamed. It puts pressure on the nerves, and that can also cause degeneration, arthritis, and also even herniation in the spine. So all of that pressure you're putting every day because of the lack of posture, and you're sitting like this the whole time, it's really important. I would say almost 90% of the headaches will go away to fix that posture and the proper curvature. So allow the shoulder to kind of curve back and allow the head to be properly aligned in a straight line. So it's really important to keep that in mind. And also the pressure on the uppermost vertebra, which is your C1, C2, C3. It can also slow down your metabolism and causes increasing weight and fatigue. And the same nerves also control your thyroid and blood pressure, because they're the ones that's closest to your brain stem. So they control a lot of things besides your muscles and the headache and everything else that's going on in that area. And then we got the food triggers. So tyramine found in many foods, which is basically produced from a natural breakdown of amino acid tyrosine. So any food that has tyramine and histamine can cause blood vessel to dilate, and this may be the start of migraine chain reaction for some people. So food with tyramine is generally preserved or aged, and for this reason you should be very careful with leftovers in the refrigerator more than 24-48 hours. Anything that's aged, dried, fermented, salted, smoked, pickled, processed, the more aged they are, the more trigger you may have. And so it's really important to control that.
Now we are going to take a short break, and when we come back, I'm going to talk more about potential migraine and headache triggers. There are several nutritional triggers that we need to pay attention to. One is skipping meals. One of the most common triggers of headache is skipping meals. To prevent headache, snacking frequently between meals throughout the day would help fight these hunger-induced headaches. Caffeine is another common trigger. What caffeine does, it narrows the blood vessel around the brain, and then when you stop drinking caffeine beverages, the blood vessel would expand to their own original size. We feel this expansion pressure as a headache. This is called the withdrawal headache also. And usually for every cup of coffee you drink, you need to drink 1 cup of water to offset that caffeine dehydration. Dehydration is another common trigger of headache. The body is made of up to 65% water. Dehydration causes the blood to become thick, therefore it doesn't travel throughout the body easily. Especially gravity doesn't let it reach the brain. That's important to keep the body hydrated to prevent headache. Caffeine, sugary drinks, fruit juices, all has dehydration effect as they promote urination. Ethanol in alcohol is diuretic and causes the body to lose water, salt, vitamin, and minerals, creating dehydration in addition to chemical imbalance in the body. And also brain. It doesn't get these nutrients, leading to headache and migraine. Nicotine in tobacco stimulates the blood vessels in the brain to contract and causing headache. Exposure to secondhand smoking has the same effect. Nitrates and nitrates in processed food such as MSG in food has these migraine triggers, and also some medication can trigger migraine also. Not enough fiber in your diet can promote headache and constipation. Eating fiber would help to keep blood sugar level and even in the body and prevent fluctuation and eliminating headache. Another trigger is low level of magnesium in the body, which cause a dilation of the blood vessel, causing headache and migraine. After the break, we will be back with Dr. Gyzel again, and she would explain to us how migraine can be treated and I will explain to you how to fight headache and migraine in natural way. Dr. Gyzel, what is the solution and treatment for headache and migraine?
So unfortunately, Azar, a lot of people take medication as part of the solution for their headaches and migraine. And it's very unfortunate because it causes a lot of side effects, and it shouldn't be the way for you to treat headache and migraine. And so unfortunately, over 100,000 Americans die from medication each year according to AMA. And if you're taking overuse of Advil, Tylenol, aspirin, any anti-inflammatory drugs that you do take it on a routine daily basis because of your headache and migraine, it can cause a lot of other side effects such as increasing kidney failure. Also, it can cause a lot of problems in the stomach lining, and eventually can cause ulcers. So if you are someone who does experience headache and migraine on a daily basis, make sure you understand what's the source of this problem coming from. So if it's coming from lack of sleep, if it's coming from emotional stress, if it's coming from your posture, if it's coming from your nutritional deficiency, dehydration, any of these things, you have to understand the cause of this and eventually find out the source and eventually find out the cure for it. So it shouldn't be something that you take medication routinely every day if you are someone who experiences headache on a daily basis. Natural cares, like I said, nutrition, making sure that you don't drink that much caffeine, making sure you drink a lot of water, making sure you eat a lot of food that actually open up and actually make you feel more hydrated, more energized, raw food, vegetables, fruits, things that are not processed and pickled as what we talked about. Proper sleep, proper use of pillow that you're using, exercise. Obviously, what we talked about last time, it's huge important for you to have that routine exercise because it will actually generate a lot of chemicals and hormones in the brain, and it actually balance a lot of things in your body. It opens up your spine, it helps with your posture, it has a lot of good effect. And then obviously positive mental attitude, and if it's due to posture, make sure you consult with your doctor, with your chiropractor, and realize what's the problem. If there's a lack of curvature and the spine misalignment, make sure you take that pressure off the nerve and the muscles and fix that problem.
Proper nutrition can help to reduce and to prevent severity of headache and frequency of occurrence of migraine pain. The following vitamins and minerals are important to prevent onset of headache and or migraine. A diet high in magnesium may help to reduce the severity of migraine. Although nuts such as Brazilian nuts and almonds are good source of magnesium, but unfortunately they are migraine triggers. So you should avoid them as much as you can. Good leading source for magnesiums are amaranth, avocado, barley, brown rice, buckwheat, chocolate, flax seeds, oysters, pumpkin seeds, quinoa, spinach, sunflower seeds, sweet potatoes, Swiss chard, white potatoes, and whole grains. The other one is riboflavin, which is also some call it vitamin B2. They work by increasing energy at the cell level, reducing the severity and frequency of headache and migraine. The good leading source for them are avocado, broccoli, clams, duck, pork, lamb, milk, mushrooms, spinach, yogurt. Vitamin C is another one, which is antioxidant property of vitamin C can protect the body against migraine and headache. Leading sources for vitamin C are kiwi, mandarins, oranges, potatoes, red bell peppers, red cabbage, strawberries, and tangerine. Water is essential for proper functioning and hydration of body. Dehydration can cause headache and migraine. Water is inexpensive, sugar-free, calorie-free, and fat-free. To avoid dehydration, you should stop taking caffeinated beverages, sodas, fruit juice, and other sweetened beverages. Fiber can protect your body against cancer, IBS, which is irritable bowel syndrome, lower the cholesterol, decrease heart disease, promote weight loss, prevent constipation, and help to reduce headache and migraine. The leading sources for fiber are whole grain breads, oats, flax seeds, chia seeds, vegetables, and fruit. Adding omega-3 fatty acid into your diet can help to reduce inflammation. Although nuts such as hazelnut and pecan are good source of healthy fats, but unfortunately they are migraine triggers too, and you should avoid them. Leading sources for omega-3 fatty acids are avocado, beans, such as kidney beans, navy beans, and soybeans, dark green vegetables such as Brussels sprouts, kale, spinach, eggs, fatty fish such as herring, mackerel, sardine, trout, tuna, wild salmon, also olive oil, and seeds such as flax seeds, chia seeds, pumpkin seeds, sunflower seeds, and sesame seeds.
So, Azar, I would like to share a peer-reviewed journal of chiropractic medicine to everyone. I think it's very interesting, and it adds a lot of knowledge to understand really the scientific reason behind having headache and migraine. So, one proposed mechanism of treating migraine headache with chiropractic treatment is through alteration of pain sensitivity of central nervous system. The trigeminal nucleus innervates the cranium, intracranial, and extracranial blood vessels. The reason behind the cervicogenic headache is because the afferent from C1, C2, and C3 nerve roots innervates the dura mater, the scalp, and many suboccipital muscles. This mechanism can cause irritation and pain to head and its surrounding due to any kind of subluxation or misalignment in the spine within the cervical vertebra. Also, it has been clinically proved that the decompression of C2 nerve root in reduction of nausea, vomiting, photophobia, and phonophobia, which is also sensitivity to light and sound. Migraine remains a common and unbearable condition. It has estimated that incidence of migraine in males is less than females, 6% in males and 18% in females. In America, about 23.6 million people have experienced migraine attacks. The annual cost of it has been calculated with medication for about $13 billion. The majority of migraines are treated medically, but it has been proven that it will be treated and improved by natural care, alternative care, by chiropractic adjustment. Chiropractic has long history of integrating rehabilitation techniques, and some techniques could be muscular strengthening, rehab exercises, relaxation, stretching, electrical stimulation, ultrasound, and traction.
Exercise is very important because it would make a flow of blood into the brain and reduces the headache,
Exactly.
migraine. It's very important.
Yeah.
One of the most important things. Thank you very much, Dr. Gyzel, for being with us today. It's important to take good care of yourself and understand how to avoid and how to cope with migraine pain when it strikes. The most effective way to reduce the frequency and severity of migraine is to adapt a healthy lifestyle by eating the right food, cooking your own meals, and healthy activities. By avoiding certain foods and beverages that leads to migraine, you will be able to manage your migraine better. To determine the triggers, it's a good idea to keep a diary. Note in your diary what you were doing at the time of onset, what you were eating, and what time of the day it happened. how long did it last, and how it got better. Thank you for joining us today, and remember, there is no better time than now to start living healthy.